next couple of weeks, I'm going to share with you guys some information on lower back pain, particularly pain and strengthening exercises for the sacroiliac joints, which are these two joints down in the base of your spine. So you've got your coccyx and then your sacrum here, big triangular bone that connects into the ilium. So your sacrum and your ilium, called the sacroiliac joint. Now these two joints are supported by some really stable ligaments. So a lot of people will explain, a lot of different health practitioners will describe pain from this area very differently. But in my opinion, it's a very stable and strong joint surrounded by lots of ligaments. So it's very unlikely that it's going to go out of place, which is commonly described to happen. It doesn't go out of place. You might feel that you're out of alignment or that it's stuck, but that's actually a perception happening in your brain. It actually doesn't mean that it's out of place or out of alignment. So everything we do as chiropractors or as a sports chiropractor is aimed at changing the way your brain is perceiving where these joints are in space. So remember that this joint doesn't go out of place and it's very stable because it's got really strong ligaments. Here are a couple of different exercises I like to give my patients to help mobilize and get that lower back feeling a bit better. So the first exercise that I like to give is down on the floor. It's a muscle energy technique. So you're going to be lying on the floor with your legs up at 90 degrees, creating a 90-degree angle through here. You're going to push into your hands for 5 seconds and then relax. Trying to keep your back flat into the floor. Then you're going to take your hands, place them inside your knees and push into your hands for 5 seconds at about 50% strength. So it doesn't need to be hardcore. It just needs to be, you need to be meeting the resistance of your hands. And then you can take both hands, place them up on top of your legs and push down. And you might feel a little shake, which I currently am. And that's your body learning this new movement. You can take one hand on top of your knee, one hand, underneath your knee, the opposite hand on top of your knee, and then just push gently into your hands. What that will do is will help retrain your brain and your muscles to help get those SI, sacroiliac joints moving a little bit better. The other exercise is another sacroiliac joint mobilization technique, which is a cat-camel movement. So you move into the cat, nice and high through your lumbar spine, and then stay in this high cat position, and then push your right hip on top of your right heel, and then shift your body, shift your left hip over your left heel, and then move backward and forward a few times, and that'll help loosen off and get that lower back moving a little bit better. So I hope that helps.